Good afternoon, everybody, and welcome to the last webinar for this month. My name is Latricia Johnson. I'm the founder of On Time Ministry, TTS 1000, and the Love Ministry. This is a Love Ministry webinar. I'm going to go ahead and share my screen with you real quick. Just give me a few minutes to get everything set up. Click this off here and go ahead and share my screen off Zoom. Hope all is well with everybody this afternoon on this amazing Tuesday. So let me move that here, and let me click this here. Let's see if I'm gonna do a good job today with this slide, because I was pressing all kind of buttons yesterday, everybody. All right. This presentation is talking about cancer. And if you know of people who have suffered with cancer or know somebody outside of it or experienced in your own personal life, you know, cancer is like talking about heart disease, and it's like talking about mental illness, it's like talking about dementia, Alzheimer's. Cancer is like one of those conversations that are talked about so much, like many of the other ones that I just presented. So today they said, let's talk the different type of cancer in men and women. So the first one I'm going to be talking about the women, and then the last two I'm going to be directly talking to the males this afternoon. So ladies, if you know some fellas who need to know some of this information, please tell them to come on to Latricia Johnson and at the bottom Remarkables webinar, or have them watch the replay later on, because this will be on my page. And after I get through the two webinars that I did for Monday and Tuesday, will be uploaded on my YouTube channel probably by the end of the week. So if you're not on Facebook, make sure you tell them to go to my YouTube channel, which says on there On Time Ministry TTS 1000. It says Latricia Johnson, and they can click on there and watch my webinar on the TTS YouTube On Time Ministry and TTS YouTube channel. Okay. So moving on to my next point. Cervix cancer. So this is the stage, looks like what it says, stage 1 of cervix cancer. So this is what this looks like here. It says 4 centimeters or smaller of cervix cancer of the cervix, stage of a cervix cancer, stage, and it says 1A and 1A2 of a cervix cancer, and 1AB of a cervix cancer, larger than 4 centimeters cervix cancer. So a lot of you like, Remarkable, what is cervix cancer? Okay, a lot of times when you are, for the ladies, pay attention now. So when you go to the gynecologist and get your pap smear, a pap smear is what women get done, and they get it done and they scrape the walls of the uterus to check if any signs or anything going on with the uterus, and if they see any type of bumps or anything, they see bumps, or if your pap smear comes back positive, they're basically saying HPV, which is human papillomavirus, is kind of like, okay, my PEP came back positive. So the doctor's going to call you and it's going to explain to you, like, hey, your PEP came back positive. Need you to come in so we can do a biopsy down there. So what they do is they call you back in. So they have a doctor that go in and do further investigating to see what's really on your cervix area where your uterus is at. They want to see, why did your pap smear come back positive? And then when they find out, they go and test the cells. I mean, take the skin and sample it to see if it's cancerous. And if it comes back cancerous, yeah, yeah, yep, yep. And for those of you who are pregnant and may have boys, and they do a pap smear on you while you're pregnant, and your pap smear comes back positive, they do the same thing, but the only difference when you're pregnant is they have you go to the OBG. It depends on what circumstances may be in, pretend of how doctors and practitioners and all those do their doctorings and skills in the office, or maybe take you to the hospital. But whatever they do it and however they do it, they bring you back in to do further investigating to find out, why did your pap smear come back positive? And a lot of times when they come back positive, it has a lot to do by what you're carrying in terms of pregnancy. And your pregnancy can kind of be off balancing, because I know they had tested me positive for HPV, and they basically wanted to do thorough things on me to find out why did it come out. And come to find out, I did not have cervix cancer. I didn't have that. And a lot of times when you come up positive with that, it's because of what your hormones and things going through, and that's those who are pregnant. But in many other cases, if you come back with that result and they do find something, they will have to do special treatments due to the fact that you're pregnant. So every circumstance and everything is quite different. But yeah, I was tested years ago with my last child. They tested positive HPV, which is kind of the sign line of cervix cancer. And thank goodness that everything came back good. I didn't have it. My baby boy was born healthy and strong. But the point I'm trying to get across to you, everyone, is that make sure you get your pap smear. I know a lot of people do not have health insurance, and I know some people don't feel comfortable letting somebody go down there and check. I'm telling you, it'll save your life. It saved mine. And I pray that you go to these resources or find people that will connect you and help you get there at some of these clinics and just get it done. I'm telling you, you get it done, you don't want to deal with cervix cancer. It's just not a good situation because that will really mess you up internally. That will make you bleed and it moves. And I'm being very graphic because I'm explaining to you what happened to somebody I love. You will start to get tumors in places you don't want. You will start to bleed in places you don't want to bleed in. It will make your blood count cells go really down real quick where you may have to get a blood transfusion. Y'all listen to Remarkable now. Where you can't even get up because your blood level is so low. Keep in mind, your body is fighting off of this massive thing. And I know a lot of times we're scared to find out what we got, and we're afraid to go, but sometimes you might just put on your big girl panties and go to save your life. There's a couple of things I've done. I had to go through this procedure when I was pregnant with my last child. I was scared all does. I cried when that doctor told me that. But to God be the glory. I'm still here, and I'm here to tell everybody, please, ladies, get your pap smears, get it done. Let them check you out. And if you don't have insurance, reach out to resources out there that can connect you with agencies that'll do these services for you. It don't hurt to call. It don't hurt to ask for help. Can't always think you can do it and rough it out on your own. It can save your life. And if the cancer is too bad, this is where it leads to a hysterectomy where they take everything out. And then I'm going to go ahead and share my next screen. And I'm going to take you to the cancer cervix website. And then I'm going to have these two videos. I'm going to have to take my microphone to hear what the doctors are saying, okay? Okay. This is cancer.org, and it's basically giving you information. So let me click on this because I ain't going to be very long on this webinar because I want you to be informed and educated today. Yesterday, I didn't have much to say in terms of voting, but with this breast cancer and prostate and cervix cancer, I have a lot to say about this because I've experienced the whole testing positive through HPV. They had me reading brochures about cervix cancer, and I can talk a lot about breast cancer because somebody I love had passed from that. Plus, so it's a lot of I can really help people with. So what I explain with my experience with my own is what is cervix cancer, and I explain to you what it is. Okay. So here's the information here that kind of gives you thorough explanation on what it is and how it happens. And it gives you a demonstration of what it looks like and how this happens. And then they have the pre-cancer of cervix, and it basically explaining to you in details what's really, I'm going real slow so you get a chance to kind of read about what I'm showing to you. I'm not going to go fast. And they're telling you the different numbers and what it looks like, everybody. Okay. And the goal of a cervix cancer is to see if you have early protections of cervix cancer, okay? And they always encourage you, pap smear and HPV testing. If you test positive for any of those, that's real, yeah. And HPV, like I said, human papillomavirus. And they always ask you when your parents were engaging their child with the HPV vaccination, it kind of prevents that. And as I explained to you earlier, from my experience alone being pregnant with my last child and what I had to go through, I wanted to be able to enlighten you about these procedures, ladies. Okay. So these are some of the things that they're talking about in this content, okay? And they got the type of cancer, the type of cervix cancers, and they have some that are more significant than others. It's like the early detection, the better, okay? You have most of them from 9 out of 10 cervix cancers are the squamous cell carcinoma. This cancer developed forms cells in the extra cervix square cell, most often being in the transformation zone where the extra joints. I don't know these big words, so bear with the queen, but as I kind of pronounce them, I want you to understand what I'm saying. There's different levels to cervix cancer, okay? Some can be more aggressive than others, okay? That's why hopefully you make sure that you catch it early, okay? Catch it early. I know a lot of times we're busy dealing with our life, but if you can do by all means, please do. And then this is the second one they're talking about. And this is the third one. And then there's a mixture. Okay. So I'm going to go back to the top and I'm going to show you the key statistic for cervix. And I'm going to talk about kind of research they're doing. But this link that I'm showing you today, ladies, on this particular part of the webinar is to educate you, young ladies and ladies older, that this is important to get your pap smear. It is it's crucial to get your HPV tests. All these different things are necessary because this is what needs to be done. And they said cervix cancer mostly occur and diagnosed in women between the age of 35 and 44, with the average age as diagnosed by 50. Okay, it's rarely developed in women younger than 20. It is rare, but it can happen. Okay, it can really happen. This is why, if you have history of somebody in your family who has had cervical cancer, or is in the who has had cervical cancer survive, or who has passed and it's generic, I advise you in your youth age to get tested. And please stress that to the insurance company, because a lot of times insurance companies do not want to pay for that coverage for you to go and get a pap smear because of your age. You have to be 35 or older, or whatever the situation, to get it done. And it's a risk and it's a fight. This is why they have advocates to speak for people who have trouble trying to get this stuff taken care of. In my case, I did my PEP quite a few times when I was pregnant. Keep in mind, I'm not a big fan of doctor back then, but now since my mom has passed, I have gotten pretty much everything taken care of and everything looked good for me. I just got one more thing to take care of, and that's the dentist. But other than that, all my reports, everything has came back good. And I am grateful, everybody. I am so grateful. Okay? I'm telling you this, why it's important to get yourself checked out. It really is. We overthink and fear stuff. If something in your body doesn't feel right, ladies, by all means, seek medical attention immediately. If you got to cry it out, you got to shake it off. You got to, and I'm not talking about shake it off and move on. I'm talking about shaking just to get in there and pray your way through it, or meditate, or get your mind off it. Try to, at least. By all means, do the necessary thing you need to do, everybody, because I'm telling you this why it's important to make sure that your girls down there are on checked. Okay? I'm dead serious. Okay? This one is talking about stimulation lump nut biopsy. So they do this procedure where they have you on the table and they take a sample of something and test it. And this is what I was talking about before I went to the website. And they test it to see if it's cancerous cells. And if it comes back, this is where they want to do operation. This is where they want to put you on extensive hardcore chemotherapy. This is where they really want to treat this thing. And a lot of times when they open it up, it can sometimes spread. And a lot of people are kind of scared to deal with that, because if you open up and it hit air surface, then you're scared that it's going to spread, and it's going to spread to other parts in your body that is weak. I'm going to tell you why. Because a lot of people have been like, I don't want to do this, I don't want to do that, because I've heard that this and that. Everybody's situation, everybody's issue with surgery and things may not different. If your immune system cannot handle surgery, ask your gynecologist what other procedures they can do for you. And if you have waited too late in the process, this is where they will refer you to hospice or trust bridge to make you comfortable. And I'm sorry for those of you who I'm making kind of sentimental, but this is how the procedure go. If you have waited too long, this is what the option is. It's either get the surgery and risk your life, or it's either go ahead and make yourself comfortable and just basically live out the rest of the remaining years, or excuse me, remaining days through this. I'm being as transparent as I can, because the doctors are going to say it's going to say the same thing. Yes, I'm saying it in a way that, let's see how these doctors and professionals say it, and some of them going to say it to you just like that, and they're going to be completely honest with you about what your odds and your chances are. Now, if you don't test positive in these things and you catch it early, that means you get into treatment and radiation immediately. Yes, the chemo and all that stuff is that chemo is going to make you sick, and then the radiation is going to leave burns in places. But at the same time, you got to think about it. Think about it now, because I've seen loved ones of mine who have went through the treatment, and it's a horrible thing. They're tired, they're weak, they're exhausted, they're mentally, spiritually drained. But if they didn't go through that just to save their own life and just let it go because they were afraid, what would the chances are? Okay. I'm speaking from watching people in my own family go through this. Grandma, she died of stomach cancer. My mama passed away from cancer. This is really sensitive topic to me. I have no problem talking about it now. Y'all wouldn't catch me talking about this way, way back when. I'll talk about it, but now I feel like I should be an advocate of this. Had an incoming message coming in. But like I was saying before, these are some of the things. So now I'm going to slide down and let you read some more of this. This is very, very useful information. And if you know somebody's going through this, who had been recently diagnosed with this, or they're having concerns and questions, and it's okay to ask your doctor and your nurse practitioner about certain things about what it looks like. Um, this past weekend, I was actually in a webinar with some ladies out of Gainesville, Florida. You know, I'm really dedicated when I took my Saturday. And keep in mind, I had my babies, so they want to do this and do that. But I spent about 2 hours on that webinar, and I never met any of these women. But the purpose of me going to that webinar was to just learn more about what other people have going on in other places, and how their services and things are run. Keep in mind, it's in Florida, but it's in northern Florida. And I was very relieved that I was able to learn a lot about these different nonprofits up there in Gainesville. Keep in mind, I'm not from Gainesville. I'm trying to think of a few family members up there, but I have to understand that, hey, every system and everything is worked differently in different parts of the world and different parts of Florida too. Yeah, they follow by guidelines, but they have different resources up north that I didn't realize they didn't have down here. By being on the call with the two nonprofits, I think it was two, yes, two. And whoever went on my page, it was called the Cupcake Conversation. I was on that call with those women. And that was my first time being a part of that. And I just wanted to see what the nonprofits were talking about. And the ladies had some very powerful testimonies and stories to share with us women and young ladies that were on the call. But the point I wanted to give across is, even me getting outside information from other nonprofit organizations helped me to say, hey, I want to be an advocate for the love ministry and educate the people about cancer, diabetes, high blood pressure, cancer, diabetes, dementia. What else? Heart disease. All these different elements, and not only target the health issue, but also target the mental, the physical, the emotional, the homelessness, the human trafficking. So there's layers of the love ministry that I want to share with everybody. and I want to give you the right information. So why I take the webinars and the educational tools to not just enhance myself, but the information that I do share, I want to educate other people. So I'm just giving you a little snap and a little sneak peek of what the love ministry looks like. This ministry is to educate. This is the layer that I'm talking about. This is the third layer of educating people about different things they should be vigilant about and aware of. Sorry, everybody. Everybody contacted me during the webinar. I truly apologize for those that are tuning in. Okay. That's what time we gotta be. This. So in the next part of it, you have the HPV vaccination, which they give you when you are yay high, and it kind of prevents the infection. Like I talked about prevention, they'll give it to you when you're young, and they always ask you at the pediatrician, do you want your child to have the HPV vaccination so they don't get the infection when they get a little bit older? And that's a lot of information to absorb. And also too, while I'm on this topic with that vaccination, it prevents women from getting it, and well as advancing and catching cervix cancer. And a lot of you talking about, what is HPV? Oh Lord, they were trying to kill me. What is HPV? Human papillomavirus. It's when you have been with different people sexually. And how do you obtain it? It says most of the people in the world contract it over time. I did the research years ago and I read about it. So that's how I can sit here and talk about that. Over time, it's being with different partners, and that's how you contract the HPV. And a lot of people walk around here don't even realize they have it until they have to go and get tested. And that's how they found out they have HPV, and that's how it leads to cervix cancer. Okay. Target therapy. So this here is talking about the therapy stuff they may want you to take. And this in terms of chemotherapy drugs, that strong stuff. And they have different brands of medication they may want you to take while you're going through these treatments. Okay. So this is something here I want to show you real quick before I let the doctors and the expertise get on here and say what they say if I take this microphone off. And I think I clicked on this already. I did. So let me get out of this. So this is the website for this one here. It's called www.cancer.org/cancer/cervix-cancer. And this is a good information tool, and YouTube and many of them, but the couple of clips I want to explain to you kind of explain it thoroughly. So you can go through this website and have any questions or answers and whatnot, and basically tell you what to look out for and what would the results be before and after everything comes out. Okay. So now I'm going to go ahead and click this off and go back to my presentation. Hold on, everybody. Always busy. And my presentation skip. I'm sorry, everybody. Y'all looking at all this stuff here. I haven't even got to the mail part of it. So y'all got an eye opener while I walked away. I think my mouse or my keypad did some things. So let me take my microphone off, everybody, so you can watch these two videos. The woman's talking doctor, and then they had a male doctor. So I'm going to start off with the male doctor first. So let me take my mic.
My name is Dr. Joshua Cohen. I'm a gynecologic oncologist at UCLA Medical Center. In honor of Cervical Health Awareness Month, which is January, I'd like to take the next few minutes to discuss with you what cervical cancer is and what preventative measures that you can take to reduce your risk of cervical cancer. The cervix is part of the uterus. It's the part where when moms have babies, it dilates and babies can travel through the cervix to be delivered. I describe the cervix as part of the uterus the same way that we can think about the state of California. Northern California is the uterus. It's the top part. Southern California is the bottom part, which is the cervix. They are connected, and geographically they have some similarities, but they're actually very different. And so when you see your OBGYN, when they do a pap smear, they're testing for precancer cells of the cervix. In this picture, that's the bottom part here. This is the top part of the uterus, and the bottom part is the cervix. In the United States, 14,000 women will be diagnosed with cervical cancer this year. And in my opinion, that's too high. There are measures that we can take to reduce your risk of cervical cancer, and we're going to talk about that next. Unfortunately, this is a disease that affects women both in the US and internationally on a large scale. Cervical cancer is most commonly caused by the human papillomavirus, HPV. There are many different strains of HPV, and 80% of the population will be exposed to HPV during their lifetime. Currently, there are 79 million Americans who have HPV, and 14 million people will acquire HPV this year. The HPV vaccine is very important to reduce your risk of cervical cancer, and we'll talk about that because we know the vast majority of cervical cancers are caused by HPV. The cancer is best prevented when someone receives this vaccine early in life. And if you look at the recommendations from the Centers for Disease Control and Prevention, that's going to be between ages 11 and 12. Early detection can be performed with pap smears. And so when you see your OBGYN for an annual visit, usually they'll talk to you about whether you're due for a pap smear. And that's because the pap smear is a good screening method for cervical cancer and precancers of the cervix. There are some rare types of cervical cancer that are not driven by HPV. And that's why I still encourage you to be aware of the symptoms of cervical cancer, which can include irregular bleeding, spotting with intercourse or sex, and new symptoms like pelvic pain. How can we prevent cervical cancer? There are some very basic steps. The most important one is to consider the HPV vaccine. I would encourage everyone who meets criteria to get the HPV vaccine. It's very safe. And as a father, I'm going to recommend that for my two children when they're of the right age. The FDA has just approved the HPV vaccine for people up until age 45. The Centers for Disease Control and Prevention is going to review that recommendation. And if they also agree, insurance companies will now start covering that vaccine up until age 45. Currently, insurance companies are covering the vaccine between ages 9 and 26. The other recommendations to prevent cervical cancer would be to reduce smoking if you are smoking, or to stop smoking. Smoking is linked to cervical cancer. Also, to see your OBGYN for appropriately timed pap smears. Pap smears used to be done every year. We're now spacing that out for patients based on certain criteria, but I would still encourage you to see your OBGYN once a year for an annual exam and discuss with her or him whether you're due for a pap smear and or HPV test. And then lastly, be aware of symptoms. Discuss if you're having bleeding with sex or bleeding between periods. Bring this up with your doctor, whether it's your internal medicine doctor or your OBGYN. Advocate for yourself to make sure that there are no symptoms that you're ignoring. We here at UCLA want you to do well. We have an entire department of OBGYNs, and if you have any questions or concerns, the information is here to call and make an appointment. We also, like myself, have a group of gynecologic oncologists that specialize in cervical cancer, and we're here and happy to answer any questions you have. Thank you.
Today we're going to be talking about cervical cancer, the signs, the symptoms, and very importantly, the prevention. In the United States, 14,000 patients get cervical cancer each year, and 4,300 patients die from cervical cancer each year. Worldwide, it's an even bigger issue because over 260,000 patients globally die each year. The interesting thing is that the virus responsible for causing most cervical cancer, 80% of the population is actually exposed to it in the United States. The good news is that cervical cancer is preventable as long as patients have access to two things. Keep watching. I'm a physician who practices at Emory University Hospital Midtown here in Atlanta. I completed my Med-Peds residency at Georgetown University Hospital in DC. Then I completed my nephrology fellowship here in Atlanta at Emory. I went to medical school at Meharry Medical College. I have since become triple board certified, and I now enjoy sharing my knowledge as a medical expert commentator. So thank you so much for watching my channel. If you haven't done so already, please subscribe. Question: are any of you survivors of cervical cancer, or have you had a scare with an abnormal pap smear? If so, please share your story by commenting down below. Also, if you have not done so already, please check out a related video with female health. I did a video on breast cancer. Please click the link to watch it. So what is the cervix? The cervix is a part of the female reproductive anatomy. It is the lowest part of the uterus or the womb. The cervix is about 1 inch long and is shaped like a cylinder. In fact, the cervix is the part of the uterus to which OBGYNs refer when pregnant ladies are delivering babies and they say the lady is this many centimeters dilated. They're talking about the cervix, where they're talking about that dilated cylinder at the bottom of the uterus. Cervical cancer is more common than it should be, and the most common cause of cervical cancer is HPV, the human papillomavirus. Some signs and symptoms of cervical cancer. If you have cervical cancer, you can get abnormal vaginal bleeding. So you may have bleeding even when you're not on your menstrual cycle. You may also have some spotting or some bleeding after sexual intercourse. Other symptoms of cervical cancer will include pain, especially pelvic pain. And if that cervical cancer has spread or has become very invasive, you can even get kidney failure. This is because the cervical tumor can actually block the flow of urine from the kidneys. So these are the signs and symptoms of cervical cancer. But the goal is to prevent cervical cancer, so you never have to endure these signs and symptoms. So how do we prevent cervical cancer? We do so with screening and prevention. And our two main tools are the pap smear and the HPV vaccination. So let's start with the HPV vaccination. HPV is also known as human papillomavirus. It's actually a sexually transmitted infection. It's an STI. It is the most common sexually transmitted infection. The tricky thing about HPV is that if you have HPV and you're a carrier, you likely have no symptoms. So if you're someone who has had an abnormal pap smear and they told you it's because you got HPV, please don't automatically be mad at your partner, because your partner was likely a carrier who had zero symptoms, no way of knowing. 79 million Americans have HPV, and it's estimated that 14 million more will get HPV this year. So again, HPV is a sexually transmitted infection. It comes from skin-to-skin sexual contact. That means you can get it from vaginal sex, from anal sex, from oral sex, even from hand to genital contact. You cannot get it from things like sitting on a toilet. That is a myth. To prevent getting HPV, abstinence from all sexual activity is, of course, the best way. Using condoms or barrier methods can help to prevent HPV, but it's no guarantee. One of the greatest tools we have now is the HPV vaccination, which is now available and actually recommended in order to prevent HPV infection, and it's been proven to be very effective in preventing cervical cancer. 99.7% of cervical cancers are linked to HPV. So what does that mean? If we can actually eradicate HPV or get more and more people vaccinated, we can severely decrease the amount of cervical cancer. So the HPV vaccination is recommended between the ages of 9 and 26 years of age. And actually, Pediatricians start to give HPV to most patients between the ages of 11 and 12. If you are younger than 15, you should get 2 doses of HPV vaccination 6 months apart. And if you are older than 15 years old, you should get 3 doses of the vaccination within 6 months. Now, you can't get the HPV vaccination as young as 9 months or as old as 26 years of age. And now there have been some randomized controlled studies suggesting that the HPV vaccination is also safe up to 45 years of age. Let me ask you this. What do you think about offering this HPV vaccination at such a young age, at 11 or even as young as 9 years old? Should parents get their young kids vaccinated against this sexually transmitted infection, or is that too young? I want you to comment and tell me what you think. I'll tell you what I think. So yes, we are talking about cervical cancer, but because both men and women are carriers of HPV, which causes cervical cancer, it is important for both males and females to watch this video and to protect themselves against the HPV virus via the vaccination. So we talked about the HPV vaccination as a preventative measure for cervical cancer. Now let's talk about the Pap smear. The Pap smear is another tool that can prevent cervical cancer and it can detect cervical cancer at an early stage. The Pap smear is that test that ladies get when they go to their gynecologist's office. When you get a Pap smear, your gynecologist will insert a speculum. It's a tool that's shaped pretty much like a duck's beak, and your gynecologist will examine your cervix. He or she will also use a tool to take samples from the cells of the cervix. Now, your gynecologist can use a speculum to examine your cervix even when he or she is not actually doing a Pap smear. So make sure when you're getting your exams, you ask specifically, am I getting a Pap smear today? Am I being screened for cervical cancer? So once this tool is used with the Pap smear and those sample cells are taken, the pathologist is able to look at those cells under the microscope and determine if you have healthy cervical tissue or if you have some cervicitis or some inflammation or infection, or if you actually have abnormal cells that are either precancerous or if you have outright cervical cancer. Now, it is recommended that ladies get Pap smears at least by the age of 21, even if they're not sexually active at all. And if you are sexually active, then you certainly need to consult your gynecologist or first consult your primary care physician to find out when you need your first Pap smear and how often. It used to be recommended that Pap smears were done every single year. Now the recommendations vary. Depending on your risks, you may only need a Pap smear every 3 years, but again, make sure you consult your gynecologist or start with your primary care physician to find out how often you need the Pap smear. Pap smears, again, are very important because they detect cancer cells at an early stage, so you can actually catch cervical cancer when it's in a precancerous state, and this is another very effective tool for preventing cervical cancer. If you do actually develop cervical cancer, there are treatments. If it's caught at an early stage, you may be able to have a certain procedure where those cancerous cells are removed with something called the LEAP procedure. Make sure you consult your gynecologist to find out what's best for you. If the stage of cancer is further progressed, then you may actually need surgery or even chemotherapy and radiation. But again, the key is prevention. So please consult your physician and make sure you take care of your cervical health. It's also important to take care of all health. I want you to please click on my video, 10 Healthy Habits for a Better You and a Better Life, for a checklist for all of your health activities. I do thank you for watching. I want you to please continue to watch. If you have not subscribed already, please do so for my YouTube page. And whatever you do your best to live your healthiest, happiest life. I'm Dr. Frida.
All right, ladies. This was very educational on the ladies' perspective. And I hope that, ladies, I hope you take consideration in doing these important tactics And fellas, hopefully you gentlemen who tuned into the last video that I shared on this particular presentation, that you're informed as well that you can be a carrier HPV. So this video at the top was just not targeting the women, it was targeting the men and women to get the man informed about, hey, I could be a carrier HPV or besides the woman. So it gives you something to think about. You can always watch this. You can subscribe to her channel, Book Dr. Frida, Frita. She is out of Atlanta, Georgia. She's a doctor out of Atlanta, Georgia. So subscribe to her channel because I'm definitely going to subscribe because I've never seen this lady before. And I was just intrigued by what she was saying when I was watching her video. I'm like, hey, let me put this in the presentation. And I'm glad I did because she was very in detailed by what she was saying, being a physician. Okay. All right. Turning tables, fellas, ladies. Make sure you tune in because you can share this information with your uncle, your brother, your dad, because you know a lot of males don't feel comfortable talking to other gentlemen, and they may feel comfortable talking to their whatever the situation may be, okay? But this here is for the fellas. Prostate cancer in men. See, the link right here won't let me be great, so I'm going to go ahead and give you the link, fellas, and ladies who are advocates for their fathers or grandfathers or whatever the situation may be. So this bottom link is https://simplehealth.today/12 signs of prostate cancer men should know. Okay, men, check it out. So this first link I'm going to click on is going to give you the types of prostate. So fellas, make sure you tune into the webinar. Ladies, much love from the queen. If you want to stay on to hear about the prostate in men, you are more than welcome. Okay. So prostate cancer patient version. So basically what prostate cancer is, men, it's like the second leading cause of death among men in the United States. Prostate cancer usually grow very slowly, and finally treated it before symptoms occur may not improve men's health or help them live longer. Exposing the link on this page to learn about prostate cancer and treatment. So fellas, go get checked out. Don't be prideful. Don't be bold. Stop being Mighty Mouse and thinking you can rock it, because I've known somebody who passed away from prostate cancer. You like, remarkable. Who is you don't know that has some type of form of cancer? Sad to say, too many people. Okay, too many people. Too many. That part. So let me go to the caution and prevention area. I'm going to kind of just go through it thoroughly. Let me see. Let me click on this first. And this link I'm going to spend a little bit time on because a lot of males need to understand, and those who are a part of the men's life, make sure you educate yourself too. Okay, you need to know this too, ladies, for your husbands, your boyfriends, whatever, just to know what this really looks like. Cancer prevention is an act taking lower chances of getting cancer by preventing cancer, the number of new cases of growing in groups or population, and lower. Hopefully, this will lower the number of deaths caused by cancer. So this part here basically just giving you ins and outs of what the do's and don't, fellas, on how to prevent it. Like I said in the presentation with the cervix cancer, it can be genetic or whatever it may be, and you still have to be tested. So if it's a genetic thing, by all means go out. And a procedure for men, I've heard, is not a very pleasant sight, but by all means, trust me, you want to get this done. Okay, for so many different reasons. The stories I've heard. Woo. All right. So prostate cancer is a disease in which malignant cancer cells form in the tissue of the prostate. So as you can see now, first, before I start, anybody who is listening to this webinar, if you are not going to be here to educate yourself or say something that will help another gentleman get this done, by all means, please hit the exit button. Do to other people want to know about this information and resource. I'm saying this why? Because this is not a sex ed or an anatomy conversation about what a man and woman got going on. This is basically talking about how to save yourself from getting these underlying diseases, okay? I'm saying this in a respectful way because sometimes when people do webinars, they want to be very disrespectful and rude. This is not the time to do that. This is risking and saving somebody's life, okay? These webinars, especially this one today I'm doing for males, by all means, men, respect the Queen's page, okay? And anybody else tuning in who are not following on my page, respect this webinar, because I'm here to educate you like I was educated as well, to know about these underlying diseases, okay? I just wanted to put that out there doing that. presentation to make you aware that, hey, respect the webinar. It's no laughing matter about what I'm talking about. This can be a life and death situation. I could be saving somebody's life right now by sharing this, okay? So here's the anatomy here, and it's showing you what it looks like inside the men's parts, okay? And this here is basically showing you as men age, the prostate may get bigger. This is why they tell you to get tested. So as I'm showing you, because I'm going to show you, I'm going to have the doctors get on video, but I'm just basically giving you a virtual diagram of what this looks like. So this here shows a normal prostate. This shows an abnormal prostate. If you can see the difference between the two pictures, this is an issue right here. This is fine, but that is enlarged. They may have to do a lot of treatments and a lot of radiation to shrink that. And yeah, that's a lot. And it's painful. So prostate cancer is the second most common cancer among men in the United States. Okay. So they have prostate cancer screening and prostate cancer screening and treatment. So I'm going to talk about the screening in the next point. Okay, with the screening, let me slide down. They said, what is the screening? Is looking for cancer before a person have any symptoms. So what the screening is basically testing the tissue, taking a sample out of places in a man's parts and testing to see if the tissue is cancerous or abnormal. And when they find out, oh, this is where they want to start really doing treatment immediately. This is where they want to automatically get you in radiation immediately to get rid of this so it can shrink. And they do this so that way they can nip it in the butt quick. Okay. All right. So I'm just kind of going to go back up. So for those who are looking at this webinar, I want you to just be educated. I want you to be aware about certain signs, fellas, okay? All right? So there you go. I'm kind of slow and slow so you can kind of see what I'm looking at on my screen. And it's showing the same thing I showed, but for those who just joined in, I just want you to see what this looks like. This is showing you what the tissues look like. This says prostate cancer disease with malaria. Like I said, cancer cells form the tissue of prostate. And this is what it looks like. And this is what a normal prostate and an abnormal prostate looks like. Okay. And they did not take me where I wanted to go. Okay. There we go. Tests are usually screened from different types of cancers when a person does not have symptoms. There's no standard or routine screening test for prostate cancer. Digital rectal examination, prostate specific and lending testing. A prostate cancer genetic 3 RNA test may be used for certain patients, okay? Screening testing for prostate cancers are being studied in clinical trials, okay? And it's basically testing the rectum. That means it goes up places where they check the butt now, and they go up there and do all these different things. And fellas, you're gonna squint, you're gonna make that ugly look while I'm being transparent, but they're really doing some things to make sure that it's not enlarged. And I'm telling you this why is because if you have a history of that in your family, get that checked out. And if you have to go out and get your prostate taken out to prevent from having prostate cancer, by all means, do what you have to do to save your life. Okay. Tests are used to screen for different types of cancers when person does not have any symptoms. So they can be testing and see what is really going on with you, okay? Find the cancer before it causes symptoms, help a person live longer or decrease a person's chance of dying from the disease. For some type of cancer, the chance of recovering is better if the disease is found and treated at an early stage, okay? There's no standard or routine test for prostate cancer. Although there are no standard routine prostate, the following tests are being used in studies to screen, okay? So here, it's a digital rectal examination when the doctor stick a finger up there. I told you before, this is a very transparent webinar, and I'm being very detailed. So, fellas, if you can't handle it, you go ahead and hit that exit button right now. I'm trying to save your life here. I'm telling you, I've known people who passed from prostate cancer, and it was some real gruesome stuff, man. And I know people who had their prostate taken out. I'm telling you, I told you, click on this webinar, you're going to be like, oh my gosh, I'm telling you, this is uncomfortable conversations. But this is educational to see that, hey, Remarkable trying to teach us something. So as that doctor is checking to see if your prostate is normal or abnormal, okay? And that's what this person is doing to see if it's okay, if it's not, if you got other issues going on. And that leads to another test that they got to go through. So you're going to go through a lot of tests to get to the what you're trying to get to, and then the screenings as well, and they have the clinical trials and all these different things. And here's the risk of prostate screening. The screening tests have risks. The risk of prostate screening includes the following: find prostate cancer may not improve the health or help a man live longer. Follow-up tests such as biopsies may be done to diagnose cancers. False negative test results occur. False positive tests occur. Screen tests have risks. Decisions about screen testing can be difficult. Not all screen tests are helpful, and most have risks. Before having a screen test, you want to discuss the test with your doctor, okay? So now I've said what I wanted to say in terms of that. From an expertise, they're giving you options, gentlemen. If you feel like this would not be a good thing for you to go through this procedure, by all means, much respect to you. But if you feel like you want to go through this to find out what it really is that's going on inside of you, by all means, do what you have to do, okay? You're like, Remarkable, you're not a male. No, but I know people who went through it, so I can sit here and talk about it, fortunately. Yeah. The risk of prostate screening includes the following. Finding prostate may not improve the health of man living, and it have different, like I said, you do radiational treatment, radiotherapy to kind of minimize it, to kind of shrink it a little bit. Then they have the follow-up tests such as biopsy may be done to determine the cancer. Then they also too had the false negative test. Now the ones a lot of you question about the false, and I'm kind of glad they had this on this website. Screening test result may appear to be normal even though prostate cancer is present. A man who recently a false negative test result, one that shows there's no cancer when there really is, may delay seeking medical care even if he has symptoms. Okay, so pay attention if there's something negative and they already have the signs of it, but the test is coming out something different. False positive test results can occur. Screening test result may appear to be abnormal even though no cancer is present. A false positive test result, one that shows that there is cancer when there isn't, can cause anxiety and usually followed by more testing such as biopsy, which also have risks. Your doctor can advise you about your risk for prostate and you need a screening. So these two here, I'm kind of glad that it showed up at the bottom to talk about the negative part of it as well as the false part of it. It's basically telling you, so hey, if your test come back negative, it doesn't present it in the test, and that may delay you from having medical treatment because it says that you don't have it when you actually have it. And when it says that you do have it, you actually don't have it. And you're kind of confused and say, I don't have it, but I feel like I got it. And if I do have it, I actually don't have it. So it's like, where to go? This is where you consult your physician and your practitioner about these questions and answers that you may have. Okay. So let me click my screen off and go to my next point. So this is just basically showing a healthy prostate on this side, and this is showing a prostate cancer thing. So these videos I'm going to share with you. So I'm going to go ahead and let the gentleman talk to explain to the gentleman thoroughly. I did the best I could from the knowledge that I was taught and educated for. So I'm going to go ahead and share my information with you. I'm gonna take my headphones off so you can hear what is being said in this presentation. So you got 4 videos to listen to. So let me get my microphone on.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. Prostate cancer usually refers to prostate adenocarcinoma, where adeno means gland and carcinoma refers to uncontrolled growth of cells. So prostate cancer is a tumor or growth that originates in the prostate gland. Only males are born with a prostate, so this condition only affects males and not females. Typically, when there's a prostate cancer, it's considered malignant, meaning that the tumor cells can metastasize or invade and destroy surrounding tissues as well as tissues throughout the body. The prostate is a small gland, about the size and shape of a walnut, that sits under the bladder and in front of the rectum. The urethra, which is the tube through which urine leaves the bladder, goes through the prostate before reaching the penis. And that part of the urethra is called the prostatic urethra. The prostate is covered by a capsule of tough connective tissue and smooth muscle. Beneath this layer, the prostate can be divided into a few zones. The peripheral zone, which is the outermost posterior section, is the largest of the zones and contains about 70% of the prostate's glandular tissue. Moving inward, the next section is the central zone, which contains about 25% of the glandular tissue, as well as the ejaculatory ducts that join with the prostatic urethra. Last is the transitional zone, which contains around 5% of the glandular tissue, as well as a portion of the prostatic urethra. The transitional zone gets its name because it contains transitional cells, which are also found in the bladder. The transitional zone undergoes hyperplasia, or an increase in the number of cells, in a large percentage of older men. That often leads to compression of the urethra. This is called benign prostatic hyperplasia, and is often considered a normal part of aging. At the microscopic level, each of the tiny glands that make up the prostate is surrounded by a basement membrane made largely of collagen. Sitting within that basement membrane is a ring of cube-shaped basal cells, as well as a few neuroendocrine cells interspersed throughout. Finally, there's an inner ring of luminal columnar cells, which are within the lumen or center of the gland. Luminal cells secrete substances into the prostatic fluid that make it slightly alkaline, that give it nutrients which nourish the sperm and help it survive in the acidic environment of the vagina. During an ejaculation, sperm leave the testes, travel through the vas deferens into the ejaculatory ducts, and travel through the prostatic urethra. Smooth muscles in the prostate contract and push the prostatic fluid into the urethra, where it joins the sperm as well as the semen, which is the fluid that comes from the seminal vesicles. The luminal cells also produce prostate-specific antigen, or PSA, which helps to liquefy the gel-like semen after ejaculation, thereby freeing the sperm to swim. The basal cells and luminal cells of the prostate rely on stimulation from androgens, or male sex hormones, for survival. The androgens include testosterone, which is produced by the testicles, androstenedione and dehydroepiandrosterone, which are produced by the adrenal glands, and dihydrotestosterone, which is made from testosterone by the prostate itself. Without these androgens, the normal prostate cells, particularly the luminal cells, cannot survive and undergo apoptosis or programmed cell death. For example, if the testicles are castrated or removed for some reason, the prostate significantly shrinks in size, largely due to the death of luminal cells. Prostate adenocarcinoma most often results from a genetic mutation in a luminal cell, but can also be a basal cell, and it results in that cell dividing uncontrollably. Some risk factors for a genetic mutation include old age, obesity, and a high-fat, low-fiber diet. Mutations in two genes that have been linked specifically to prostate cancer are breast cancer gene 1 and breast cancer gene 2, also known as BRCA1 and BRCA2, both of which also cause breast cancer. Once a cancer-causing mutation happens within a cell, the affected cell starts to grow and replicate out of control, forming a tumor. Early on, prostate cancer cells depend heavily on androgens for survival, but eventually the cancer cells mutate and find a way to keep multiplying without relying on androgens. Overall, prostate cancer cells have a relatively slow rate of growth compared to other types of cancers. Finally, even though prostate adenocarcinoma is the most common type of prostate cancer, other rare types exist as well. These typically arise from other cell types in the prostate. For example, transitional cell carcinoma arises from cells in the transitional zone, and small cell prostate cancer arises from neuroendocrine cells. Early on, prostate cancer typically causes no symptoms, and that's because the majority of prostate cancers arise in the posterior peripheral zone, which is far away from the urethra. As a result, these tumors can grow quite large before they cause problems with urination. Over time, if the cancer does compress or invade the urethra or bladder, it can cause difficulty urinating, bleeding, and pain with urination and ejaculation. If the cancer becomes metastatic, it most commonly spreads to the bones, like the vertebrae or pelvis, resulting in hip or lower back pain. Prostate cancer can be detected by a digital rectal examination, which is where a finger is inserted into the rectum to feel against the anterior wall of the rectum, which lies along the posterior part of the prostate. A tumor located here would feel like an irregularly hard lump. But if the tumor arises elsewhere, like in the anterior peripheral zone, then the tumor would be out of reach during the digital rectal exam. Another approach is to use a transrectal ultrasound, or MRI, to image the prostate. Prostate cancer can also cause an elevation in the prostate-specific antigen. But ultimately, the diagnosis of prostate cancer requires a biopsy, so that the cells can be scored using the Gleason grading system. The Gleason scale identifies the two most common cell patterns within the prostate tissue and assigns a score between 1 and 5 to both of them. A score of 1 represents normal, well-differentiated cells, and a score of 5 represents highly abnormal cells that barely resemble the normal prostate tissue. Once the primary and secondary patterns have each received a score from 1 to 5, these two numbers are added together, resulting in a total Gleason score between 2 and 10, with 2 representing low-grade tumors and 10 representing high-grade, dangerous tumors. In terms of treatment, when the tumor is confined to the prostate and hasn't metastasized, active surveillance is usually done. This includes routine tumor marker measurement as well as imaging to ensure that the prostate cancer remains confined to the prostate. If the tumor spreads beyond that point, treatment options include surgery, radiation therapy, chemotherapy, and hormonal therapy. All right, as a quick recap, prostate cancer usually refers to prostate adenocarcinoma, but can also include more rare types of tumors as well. It typically starts in the posterior peripheral zone of the prostate and can be detected using a digital rectal examination. Typically, a serum prostate-specific antigen is also elevated in prostate cancer. Treatment might include chemotherapy, radiation therapy, surgery, and hormonal therapy, but active surveillance is also an option in many cases where it's localized to the prostate.
Hey, hope you enjoyed our video on prostate cancer. Hope you found something interesting or learned something new. You know, this is one of those conditions that people don't really like to talk about that much, at least in my culture, where I'm from, the United States. These parts of our bodies are, taboo. So we don't maybe do the things that are necessary to get ourselves checked out for these conditions, because talking about and asking people about those parts of our bodies, it's a little uncomfortable for a lot of us. I mean, I know I've been there. But hopefully this video is a good resource for you. And I'd just like to give a shout out to the people who worked on it. Charles, who wrote the script, Yifan and Rishi, who edited the script, Tanner, who did the voiceover, Kaya, who did the illustration, and me, Evan, who did the video editing. And if you like this video, you can go to osmosis.org and check out all the videos we have on Prime. There are over 100 videos that you probably can't find on YouTube. I know you can't find them because they're only there. And, just take a look around, see what you like. See you around. Bye.
Adults, let's talk about prostate cancer. Today we're going to talk about the 5 stages of prostate cancer. The PCRI has developed a system for patients. Prostate cancer is very complex. Who has time to study the full range of all the information associated with prostate cancer? Even the professionals have trouble keeping up. Patients need personalized information directed to their particular type of disease. This is what the PCRI's staging system provides. There are a lot of different prostate cancer staging systems. All of these have been designed for physicians to help them decide on the correct treatment. The PCRI staging system is designed for patients, simplified with a 6-question quiz. This is to enable patients to approach their physicians with accurate information about their disease, to raise the level of conversation with their physicians to a level that directs treatment to the specific type of therapy that patients need. So how exactly can you find your stage? The PCRI provides a simple 6-question quiz. You, with your medical records, can figure out your stage by going online to pcri.org and filling in the answers to those 6 questions. What is your Gleason score? What is your PSA? What is your clinical stage? And what do the scans show? So if you get a copy of your medical records and go online, you can immediately figure out which stage of prostate cancer you have. Many of you patients have been confronted with complex nomograms and staging systems and tables that render percentages of this or that outcome. The PCRI quiz simply allocates you to one of 5 categories. And once you've determined that, there are subtypes within each category. Each of these subtypes is attached to a narrow range of treatment options. This is not to imply that everyone would get the same treatment. Men with prostate cancer have dozens of treatment options, but they don't all apply equally to every stage. But with a specific stage, experts agree that certain treatments are superior to others. And if you know those expert recommended treatments, that's the starting place for the conversation with your physician. There may be modifying factors such as your age, your sexual functionality, your personal preferences about treatment, but at least you have a starting place. The 5 stages of prostate cancer are sky, teal, azure, indigo, and royal. The first 3 stages, that is the men with newly diagnosed prostate cancer, sky, teal, and azure, are broken down into those 3 stages because of the radically different way each one can behave. Azure is like a real cancer that if it isn't cured, it can spread and lead to early mortality. Sky is essentially harmless. It doesn't spread. People need to be watched, but they don't need immediate treatment. Men with teal are sort of in a transition, and typically most, not all, but most men will need treatment. The last 2 stages of blue, indigo and royal, represent men that have relapsed disease after surgery or radiation, or advanced disease. That means either spread to the bones or they've developed resistance to hormonal therapy. Once you take the quiz, things should be fairly self-explanatory, but questions are going to arise. The PCRI provides an extensive amount of information on its website at pcri.org. PCRI also offers a free helpline that you can call or email and get specific answers to your questions. Prostate cancer is a disease in motion. The earlier you get to the proper treatment, the better the outcome. Delayed treatment means that you're going to be fighting a more advanced foe, and you're going to need stronger weapons. Get the right treatment the first time by knowing what you're dealing with. Know your stage, and that will open the door to the best possible treatment. Thanks for watching. For more information, subscribe to our channel or go to pcri.org. Hi, I'm Dr. Scholes. A common question we get at the PCRI is, what's better, surgery or radiation? This has been a perennial question, and I think actually I'm well positioned to answer that question. Almost everybody in the prostate cancer world is either a surgeon or a radiation therapist. As it so happens, I'm a medical oncologist specializing exclusively in prostate cancer. I don't own a robot to operate with, and I don't own a radiation machine that I can send patients to and profit from. I'm just looking for what really is better. And I am immersed in this field enough to actually have a good opinion and a lot of experience. So why is there a controversy? Why is it difficult to figure out which is better? Why are there arguments and disputes about this question? Well, the real issue is how technology has evolved over the last 10 to 15 years. If you go back 10 or 15 years, surgery was much better than radiation. The radiation back then was scary. Men were getting burns, the cure rates were diminished. People were really unhappy with the results, and then if they didn't get cured, they had a mess on their hands. The surgery would be very difficult to do after the radiation. And most people are still hearing about that as an argument for surgery to this day. Do surgery first, because if you do radiation first, you can't do surgery afterwards. That was a good argument, but it's an outdated one now. So the big change that we've seen over the last 10, 15 years is an amazing progress in the precision and the power of radiation therapy. We have these computerized pencil beams that go precisely where they're supposed to go, within a millimeter or two of their target. So now you're getting cure rates that are even better than surgery. Remarkable. How can this be? Well, surgeons are constrained by the fact that the bladder and the rectum are within millimeters of the prostate surface. They can't cut a margin around the gland. The radiation therapists are not constrained that way. They can put a field over the edge of the bladder and over the edge of the rectum and ensure better coverage and thus achieve higher cure rates. So if it's just cure rates we're looking at, modern radiation is at least as good as surgery. And if you look at what they're achieving with seed implants now, it's better than surgery. Well, what about the side effects? That's really the important thing in prostate cancer, since most men aren't going to die of prostate cancer, but they're going to have to live with the side effects of this decision that they make. Potentially irreversible side effects like impotence, incontinence, damage to the rectum, which is closely adjacent. So let's take those things one at a time. So let's take the sexual question first. Sexual function after surgery is inferior in its outcome compared to the sexual functions that can be achieved with radiation. Now, there's a spectrum, of course, and men can be impotent with either approach. But impotence is much more common after surgery than it is after radiation. Another confounding factor is that surgery is associated with urinary leakage after treatment. And this almost never occurs with radiation. Urinary leakage shouldn't be minimized. It occurs in 5 to 10% of optimal candidates operated on by world-class experts. Stress incontinence, where people leak when they jump, sneeze, laugh, occurs in up to 50% of men after surgery. Another problem with urinary leakage is during sexual activity. About 20% of men leak urine during sexual activity. So these are really depressing effects from surgery that don't happen with radiation. One of the arguments the surgeons had in the past was that there's a very low incidence of rectal damage, whereas with radiation, there could be a burn on the rectal wall. And this is true. These rates were steadily reduced with better and better radiation, but never completely eliminated until the advent of a new gel spacer that can be injected between the rectum and the prostate, pushing the rectal wall away during radiation, and essentially eliminating the risk of rectal damage. So in every category that we look at, comparing these two different approaches, while surgery in the past was better than radiation, in this modern era, radiation is better than surgery. We get at the PCRI is, what's my life expectancy? I've just been diagnosed with prostate cancer. This is kind of usually a good news type answer for men with prostate cancer, because people may not be aware how different prostate cancer is from other types of cancers: pancreas cancer, lung cancer, colon cancer. Survival rates with prostate cancer are excellent. Just to give you a rough idea, the American Cancer Society on their website for prostate cancer states that of all the men diagnosed every year, 5-year survival with prostate cancer is 99%. 10-year survival with prostate cancer is 98%. 15-year survival with prostate cancer is 94%. Now, those numbers are going to be better going forward. You can't have 15-year outcomes without going 15 years into the past. And so those are statistics for men who were diagnosed, around 2000 or 2005. Men that are diagnosed in 2019 are going to have even better outcomes because technology today is superior to what we had then. And of course, men that are going to live another 5, 10, 15 years are going to grandfather into even better technology. There are men, however, that pass away from prostate cancer. What is all that about? It's basically two issues. One is some men don't get screened and they're diagnosed with very advanced disease at the get-go. And then there are certain rare subtypes of prostate cancer that behave much more aggressively. And those are the ones we all hear about, the bad news stories. So men with prostate cancer need to be very careful about defining what type of prostate cancer they have. Most of the prostate cancers are very manageable, curable, and can be controlled for very long periods of time. So survival rates with prostate cancer are surprisingly good. And of course, with modern medicine, they're getting even better. Men who are facing a new diagnosis of prostate cancer, since survival is so excellent, need to be considering how their treatment is going to impact their quality of life. They're going to live with these treatment decisions for many, many years. Many people rush into therapy thinking that fight the cancer aggressively, get cured, and don't want to die. And that type of attitude is typically entirely appropriate for people with other types of cancers. With prostate cancer, because the prostate is located in such a sensitive area, very near the issues of urinary function and sexual function, men need to be a little more circumspect, go a little more slowly, and look at the whole broad spectrum. Because thankfully, survival rates with prostate cancer in general are really, really good.
All right, everybody. Fellas, I hope you are very informed with the 4 videos that was showing through the tongue twister. I hope you gentlemen and ladies were informed by the information that was shown in the 4 videos that were played during this webinar. And my headset just won't be great right now. Hold up. There you go. All right. So as the gentleman talked about, these different elements of what prostate is, and he talks about what is better, surgery or radiation, and the 5 steps of prostate cancer and the life expectancy. And he basically started talking about the other cancers too, colon cancer and pancreatic cancer. And that's a whole nother conversation for another webinar. But basically what he was saying is, what are your chances for this? What are your risks for that? What are the different things that you should be paying attention to? So fellas, I hope this part of the portion of the webinar was very helpful and very informative, and it's the information that I share with you. So now I'm going to share my screen to the next part of the presentation. All right. This one here is talking about breast cancer in males. Awareness is very important, and educate yourself is very important. By all means, gentlemen, take your health seriously. And I think this might be my last slide. I'm not sure. Hold up. All right, I got a few more slides. I had to make sure because I'm looking at the time. So I'm going to go ahead and let you hear this video. I'm going to take my microphone off and hear what this gentleman has to say.
To do a mammogram. A lot of men don't realize that they also need to be screened, and particularly if they have family history, but they need to be screened as well. So they need to take breast cancer as critically important as it is for women.
Super tight right here. Bear with me. Get my fat fingers out.
It's rare for a man to need a mammogram, but
That's
it
true.
does occur.
Yes, we do. I don't know, probably maybe 1 a month or something like that. They usually do present with a problem, whether it's lump or pain.
I'm Terrence Shirley, and I'm the administrator for the Cancer Institute and the Division of Radiation Oncology at the University of Mississippi Medical Center. We're at the Jackson Medical Mall, one of the outlying facilities for the university. Men should be screened if they find a lump, as a woman might find a lump, and also if there's a family history. We're going to go through the process up until the point of we would beam on the radiation. So we're not going to actually beam on, but we're actually going to do everything else. We're going to simulate everything else as if this was an actual mammogram.
Male breast cancer is very rare. It's less than 1% of total cancers diagnosed. If, 10 men show up, the chances of each one of them having breast cancer is very, very small to none. But that does not mean that it does not happen in men. It does. You have to be vigilant and do the right thing and show up to the breast center. When men feel a lump, it usually freaks them out even more than it freaks out women. Because women will find lumps all the time in their breasts. Men, if they find a lump, they're like, okay, I need to get this checked, which is the right thing to do. But all lumps, like I said, are not cancer. Most lumps in men are completely benign or just increased breast tissue in the breast, which in men is supposed to be dormant. It's not supposed to grow like women. So when it does start to grow in men, for whatever reason it may be, it causes a lump and tenderness. When women find a lump in their breast, they're like, well, there's no family history. This cannot be cancer. It's not true. Don't take it lightly, because 75% of the breast cancer comes in women or happens in women who do not have any family history of breast cancer. Early detection is important to maximize your chance for a cure. Treatment is not as hard, long, or expensive as it would be if it was more advanced.
I think you did great. Most of our men that come in are real nervous and unsure. Most of them work with you pretty well because they're kind of like, okay, I don't want to mess up.
I'm glad I did this. It gives me a better appreciation for what we have over here, and gives me a real appreciation for the type of equipment and type of staff that we have. And then when I get a request for this type of equipment, I now know what we're actually buying, and it really makes a difference to them.
Breast cancer just doesn't affect women, because Angie on Facebook has said, it's a great idea, we love it, of course. I hope the same is going to be done for men. And Claire said, great idea, but don't forget that men get breast cancer too. Quite right to tell us that, of course. So we thought,
absolutely.
You know, I was thinking to myself, and I remember we were talking about this, and I said, well, if you're a man, do you check in the same way?
Yeah, it's similar. We'll show in a minute how to do this. But, 400 men in this country will get breast cancer every year. And they tend to get it at a more advanced stage because they're not looking for it like women are so much. Also, about 50% of teenage boys will get some enlargement of their breast tissue under their nipple as they go through puberty.
Okay.
So normal thing, it resolves on its own. But men have breast tissue too, usually focused under the nipple, and they should check on a regular basis, just like women do.
Well, let's do that very thing.
Let's call in Jonathan,
Absolutely.
because he is here at our disposal. Where is Jonathan? Here he is, the man himself.
Thank you for doing this.
We'll talk you through. So any guy who's in the habit of checking their testicles, which is more important, should also include the breast tissue. It doesn't take very long at all. So you might be in the shower, you might be in the bath, you've got a bit of soap on you, you can slide the fingers around, that's easy. Or if you're not in the shower, you can do it. You're looking in the mirror now, okay? You're looking in the mirror. Look for any asymmetry of the breasts. Has anything changed since last time? Look at the nipple. Is there any rash around the nipple? Is there any discharge? Anything you've not noticed before? So you've done the visual inspection.
Okay.
Now, since you're right-handed, Jonathan, I'm going to ask you to raise your left hand, put it behind you, put your hand behind your head. So now you've got the breast exposed there. You're going to use your right hand, you use 3 middle fingers of the hand around the nipple area first. Just move the fingers around the whole of the areola, the round circle around the nipple area. You're feeling for any lumps that haven't been there before. Okay. And then expand the search to the various quarters, the different quarters of the breast. So inner, upper, just feel around there, and then go down to the, that's it, to the bottom there, then across, and then up towards the top, and then into the armpit. And then finally, just pinch the nipple with a thumb and forefinger, see if there's any oozing, look for any rash. And really, that's as quick as it takes,
Really?
So you've done the check.
Have you ever done that, Jonathan?
Do you know what?
No.
I didn't even know it existed.
Yeah.
And that's something everyone can do, right?
Of course, and it's quick.
Yeah.
It's quick
The
and
other one,
easy.
people
It's quick
leave
and
the
easy.
doctor.
We'll put the video of it on.
Yeah. Men who are more at risk have got family history of breast cancer or prostate or colon cancer. They may have higher estrogen levels because of obesity or because of liver disease, or they may have been treated for lymphoma. Those men are more at risk, but any man should just do a check.
For sure. We know it's rare, but it's good to check yourself out.
Thank you, Jonathan.
I was just routine annual physical, and I noticed that there was a bump on my chest that I had my physician take a look at. At that point, she recommended that I go to imaging to get it checked out and have an ultrasound. When they made the appointment, it was for an ultrasound. When I arrived, they said, we're doing a mammogram. That's not really what I came for. But ultimately, they did the mammogram, and then that same day, they had to go back and do the ultrasound anyway. So I got all the
6 months prior, my niece was diagnosed with breast cancer while she was pregnant. And so as a family, we bonded together to support her and all that. So, of course, I did have concerns right off, but I tried to tell myself it's nothing, won't be a big deal. So shortly after my imaging results, I was called by Baylor Scott and White, one of the nurses, to schedule a biopsy. It was tough at first, to have them let you know, hey, this is cancerous and we need to do something about it. My initial reaction to it being breast cancer was pretty much, I've never known any man with breast cancer. So it's like I hit the wrong mile. And, breast cancer, wow. So I found out that it was a real thing. It does occur. Facing the reality of it was one of the tougher times in the whole situation for me because I didn't know what was next. I finally came to Baylor and I had a sit down and meet with the doctor, my wife and I. That is when the whole thing was kind of broken down to me. And she did a great job of explaining exactly where I was at. And after that, I was actually given options of how I wanted to proceed with my care going forward. I chose to go the double mastectomy route because it was such a low rate of return for the cancer. And the last thing I wanted to do was come back and go through it again. Once the tumor was removed, they sent the tumor off to be tested. And an interesting thing is that my breast cancer results came back exactly like my niece. Because of the test results, chemotherapy was recommended and I would have to go through some treatments. And once again, I said, okay. And my wife boo-hooed. Made an appointment to have a port inserted. That is how they administer the chemotherapy. Final outcome for me was to be able to ring the bell. I fought really hard to get to that point. And really my inspiration for that was my niece that I spoke about earlier. She actually had a single mastectomy while pregnant. She had a healthy baby boy, and she proceeded and completed all of her treatment and was able to ring the bell. And she's doing great. She just laid the foundation for how to go through something like this, and it's made me a stronger person. Breast cancer, for me, it's had not only a negative effect, in a sense, but a positive effect on my life. And I say that because you don't realize sometimes the support that you have until you need it. My support staff, or team, as I call them, unreplaceable. Did everything mentally and physically that they could for me when I needed them. I have a beautiful wife, 2 beautiful kids, and a huge family that loves me, and I love them. So at this point, a year later, I am 100% sure that Baylor Scott and White was the best solution for me. It was the best care that I could have chosen throughout this process. I came to the right place. I've met some great people, some people that have impacted my life, and I hope that I may have made them smile once or twice during my time here too.
And the last part of the presentation I want to share with everybody before I close for this afternoon is the type of ways on how to stay healthy and physically fit to prevent cancer. Now, before somebody say, remarkable, I'm doing everything I possibly can to stay healthy, stay fit, but I end up catching it or end up getting the disease. And when you have those kind of emotions and those kind of thoughts, and if you have history of that in your family, when you did everything possible and you still end up with it, it's a generic thing that's going on with your DNA and history. So if you have history of breast cancer, colonic cancer, pancreatic cancer, lung cancer, all of those different cancers, make sure you get a history of what your relatives have had, or do a blood work, or just get a full-blown physical to find out what is in your blood system, what type of blood you are, what are your risks to having these things. And it's a lot to go into. You like remarkable. I don't have time for that. But if you are able and capable to do so, by all means. But these are some of the resources here I just wanted to share with everybody on terms on how to just kind of reduce it or live a healthy life. And I'm going to pick and choose. So I think I'm going to start with the one with the vegetables right here on my right and let you hear what he has to say. Let me take my microphone off.
Millions of men out there are taking their vitamins, whether it's multivitamin or whether it's some sort of a supplement for their prostate health. And who knows whether it works or not. What I know is taking natural fruits and vegetables and things that is full of antioxidant is for sure a great thing for you. So what's on top of the list? Tomatoes absolutely gets the gold medal. You know why? Because tomatoes is full of lycopenes. And study after study shows that things such as tomato or tomato juice that has lycopene, perhaps not only it can shrink your prostate, but it's also, if you have early stage atypical cells, it may slow down the progression of the disease, which is great. What's right after tomatoes, which is all red, I want you to think about all green colors. Guess what? Broccoli is there. Green tea actually made the list, and surprisingly, soybean is also in the list. Why broccoli? Broccoli has a lot of phytochemicals, and studies show that phytochemicals can actually reduce the rate of prostate growth. And if you have prostate cancer and you already have had surgeries and treatment, at least it can help you from any kind of recurrence, etc. Green tea doesn't need any introduction. Green tea has a lot of antioxidants, a very potent antioxidant, and it has EGCG, which is good for overall health, not just for prostate. It can reduce inflammation all over your body. So 1 or 2 cups of green tea a day can always make you healthy and certainly can keep your prostate healthy. Soybean has been always a controversy because soy can change your testosterone level and can occasionally increase your estrogen if you take a lot of it. But I think a little bit of it is actually good for you. It has the same kind of effect as the rest of them with reducing inflammation. Guess what? We see that more and more inflammatory cells are prerequisite to cancer. So if you reduce inflammation, you help your prostate. My favorite one, and I don't want you to say too loud because I don't want the tomatoes and broccoli to get jealous, but pomegranate juice and pomegranate itself is my favorite one. I grew up as a kid eating pomegranate. You put the seeds on your salad if you want to, or your fruits, and eat it directly. But if you're not into it, you can always get a good pomegranate juice without a lot of sugar in it, and that's perfect. Twice a week, I also add salmon to my diet. Salmon is good for a lot of things. Too much of it I don't think is healthy, but overall you know that it has tons of omega-3 fatty acid, and I've always said what's good for your heart, it's good for your brain, and certainly it's good for your prostate. Cheers to your prostate and to your good health. Thank you. I'm Dr. Samadi.
Research tells us that up to 1/2 of cancer cases are preventable through healthy lifestyle behaviors. You can reduce your risk for cancer by following these 8 recommendations. Being overweight or obese can increase your risk for several types of cancer. You could reduce your risk by maintaining a healthy weight. Eating a healthy diet can help you stay lean. Fill 2/3 of your plate with vegetables, fruits, and whole grains. Limit foods like red meat and processed meat. Being physically active reduces your risk for many cancers. It can also help you maintain a healthy weight. Aim for at least 30 minutes of physical activity 5 days a week. If you don't smoke or use tobacco products, don't start. If you do smoke, even occasionally, it's never too late. Health will improve immediately. Continue to improve. HPV vaccine is the best protection against HPV-related cancers. All boys and girls between 11 and 12 years old should get the HPV vaccine. The best way to protect yourself against skin cancer is to limit your exposure to the sun's UV rays and eliminate tanning bed use. If you must be in the sun, use sunscreen with SPF 30 or higher. If you have a family history of cancer, you may be at increased risk. Talk to your family about their medical history so your doctor can assess your risk and help you take precautions against cancer. Screening exams help detect cancer early when it's most treatable. Talk to your doctor about the appropriate screening exams for you based on your gender, age, and risk factors.
While it's not possible to prevent all cancer, research has shown that there are ways to reduce your risk of getting cancer through things you do and things you can avoid doing in your everyday life.
When we think of cancer risk, that refers to things that can cause us to get cancer. When we think of cancer prevention, that refers to things we can do to reduce our risk of cancer. There are some things that we have control over and some that we don't. I want to talk about the things that we have control over in terms of cancer risk factors. These include what are called lifestyle factors. It refers to smoking and diet and exercise.
Smoking is one of the leading causes of several types of cancer, and quitting smoking is one way to significantly reduce your cancer risk.
I recognize in my practice that quitting smoking is the hardest thing that people ever do. And all too often we dismiss that and say you just have to have more willpower. The good news is that there are programs and people who can help with this, and that if you want to quit smoking, you can connect with a healthcare provider who will help you do that.
Maintaining a healthy diet is also an important way you can reduce your risk of developing certain types of cancer. And that may not be as complicated as you think.
In terms of cancer prevention, diet is very important. I talk to a lot of people and there's confusion about what diet is the best to prevent cancer. But we can simplify this to say 5 servings of fruits and vegetables per day is the best way to reduce your cancer risk. This is because fruits and vegetables contain what are called phytochemicals, and these are the chemicals that help the body and help the immune system resist cancer. Some people read about supplements and think they can get their phytochemicals through supplements, but it turns out that they are more effective if they come in the course of fruits and vegetables in a normal diet. So our message is, let your kitchen be your medicine cabinet and work on those 5 servings a day.
Another lifestyle factor that can cut your risk of developing cancer is regular physical activity.
What we're talking about is a conscious effort to exercise 15 or 30 minutes a day where you're walking at a brisk pace or doing some form of moderate exercise. One way to know whether it's moderate exercise or not, you want to walk at a pace where you can carry on a conversation with someone, but you wouldn't have enough breath to sing a song. The experts have found that 30 minutes a day, 5 days a week, for 150 minutes a week of exercise has been helpful in reducing the risk of cancer. So my message would be to find a way to work into your routine, getting that 150 minutes a week. It's different for different people, but I encourage all of my patients and myself and my family and friends to set aside that time and make it a priority as if it were a medical prescription in and of itself. If exercise were a drug, it would be $1 billion blockbuster, but it's something we can do for free if we can just take the time to do it.
Trying to control the amount of stress in your life is also important when it comes to lowering your risk of developing cancer. Talk with your doctor about stress reduction programs that may be right for you.
Stress reduction refers to those things that we can do in our lifestyle that reduce the amount of inflammation in our body. And the scientists have shown that you can measure cortisol and other inflammatory chemicals in the body, and these contribute not only to the risk of cancer, but also heart disease, diabetes, and other illnesses. Some people have found meditation to be helpful. Others find yoga to be helpful. What we've learned, however, is that diet and exercise are not just nice things to do, but they are key to improving our stress, key to reducing inflammation, and key to helping us reduce our risk factors for cancer. So if we can exercise regularly, eat healthy, and then do things like meditation and biofeedback to reduce our stress, we can really help ourselves.
To learn more about how a healthy lifestyle can reduce your risk of developing certain cancers, visit cancer.net/prevention.
There's one resource that I can recommend, and it is www.cancer.net. This is the resource provided by the American Society of Clinical Oncology. It is written for the public to understand. It describes different kinds of cancer, but it also describes diet, exercise, and lifestyle things that we can do to control cancer.
All right, everybody, that concludes the webinar of cancer information. I know it was long, almost an hour and a half long. Like I said, you can watch the replay of this webinar. It is recorded, and both of the webinars that was posted for yesterday and today will be on my YouTube channel. Again, my name is Latricia Johnson, the founder of the Love Ministry, On Time Ministry, TTS 1000, but this is a Love Ministry educational tools I want to use. Mm-hmm. Mm. Mm. Mm-hmm. Okay. Sorry about that, everybody. But again, thank you for tuning into this webinar. Have an amazing, safe Tuesday, and I'll talk to you real soon. This is Remarkable Queen of Inspiration, signing off.